Start.
Hi, how are you? This is me. While I'm hand over my sheet, I will wash my hands, introduce myself. This is me, Dr. Shahinaz Shobat, one of the pediatric doctor in this hospital. Please, can I proceed to examine the child, Bob? Bob,
Yes.
how are you? How are you, Bob?
His name is Paul. Okay. Do not change the
Sorry,
name. Paul. Paul.
Paul.
Paul. Yeah, Paul.
Paul. How are you,
Yeah.
Paul?
Yes, he's very smiley, lovely. He's talking to you. Yeah.
Mhm. Bob, I'm going to examine your heart. If there is any pain, just tell me, okay?
Yes. Okay.
Uh, I will now make inspection from the inside. He is standing or on the cot.
No, he's sitting on the chair.
Okay, I will inspect him. I can see some dysmorphic features in the face and in the chest. No attached devices, no distress. Can I proceed with examine him?
Please
Okay.
proceed.
Now I will look to the hand and please, Paul, can you make like this for me?
Yeah, no clubbing.
Is there any pain
No,
in the hand, any erythema, any
no, nothing.
stigmata of infective endocarditis?
Nothing.
I will check for the rhythm, for the radial pulse. What about
Normal.
the
Normal.
normal? Normal.
Mm,
Check for radio-radial delay,
normal.
femoral delay.
Normal.
Any scars of the hand, anything?
No.
Paul, can you please make like this for me?
Yes. No, there is no scar in the
No
axilla.
scars, nothing. I will
Mm,
check for the, can you turn the head right to the other side, please, Paul?
yes. No JVP.
Okay, very nice. You are a good boy, lovely boy. Say very big ah. Say ah.
There is high arch palate.
Anything in any cyanosis, any
No, no, no,
dental caries, nothing.
no.
Could you please make this for me?
Yeah, no, no congestion, nothing.
And no jaundice.
No, no jaundice.
Now I'm going to inspect the chest from the side. Uh, any palpitation, any hyperdynamic from the side and from the foot, also from the underneath of the foot.
Okay.
Any pulsation, any
No, no,
hyperdynamic,
no visible pulsation. No,
any scars. It seems to be no scars, but
no scar, no
like something.
scar. Yeah.
Uh, okay, now I am going to check for the apex in the butterfly like this. Butterfly.
Yes.
Uh,
So
uh,
apex is shifted downward and laterally. So it is in
uh,
the sixth intercostal space, just lateral to the mid clavicular line. Yeah.
okay. Now I'm going to check for the thrill by three thumb, the mitral, any thrill,
Yes, there is a thrill in the mitral area.
mitral area, the thrill also.
No, no other area has thrill.
No other
No.
area, and this and aortic,
Supraclavicular and aortic, no,
no,
no thrill.
no thread. Now I'm going to check for the P2,
P2 not present, not palpable.
not palpable. Okay,
Yeah,
and for parasternal heave,
not palpable.
not palpable. Now I'm going for auscultation
Mm.
on the apex.
So apex you can see forceful,
For,
forceful apex, yeah.
okay, forceful
And
apex.
heart sounds are audible, lub dub audible.
Any murmur?
Yes, there is a murmur on the apical area. Wait. Yes, Dr. Shaina, start.
Is this murmur coming with the pulse?
Yes, the murmur is coming with the pulse.
Murmur coming with the pulse. Any radiation to the axilla?
Yes, murmur is going to the axilla.
to the axilla. I can turn the baby to the left side and
Yes, yes, the murmur aggravate on turning left side.
turning left side. Okay, now I'm auscultate also the left sternal border, lower,
No other murmur, no.
either in the lower or the upper
No other
anterior.
murmur, no other murmur.
No other murmur. I can tell the child for take deep breath and expiration, and then hold.
No, murmur did not change.
Only change by
Left
the.
lateral, yeah.
Okay. Now I will auscultate for the back.
No, murmur
Uh,
is not radiating to the back.
Also for the basal of the lung, any
No,
crepitation, nothing.
nothing, yeah.
Now I'm going to palpate for if there is any hepatomegaly.
Okay,
Uh,
your time is up, Dr. Shahinas. Present your
oh,
examiner is asking if you had time. What would you like to do if you had time?
if I had time, I want to do a liver span, sacral edema, pedal edema, and I need for eye consultation, sorry, eye examination and skeletal examination.
Okay, present your case.
Today I'm just examining 7-year-old lovely Paul. He seemed to me like dysmorphic features, dysmorphic features with dysmorphing of the chest, no scars, no cyanosis, no respiratory distress. I can appreciate systolic murmur. Systolic murmur in the mitral, in the apex, radiating to the axilla with no, with a you told me with a thrill, with a thrill. This is maximum hearing in the apex,
Mm,
uh, radiating to the axilla, no stigmata of, no hepatomegaly,
no.
no stigmata of heart failure. If not transferring to the back with no edema, IQ acceptable. He is
Dr. Shahinas, start again. Only positive finding. You have 30
high arched.
seconds.
Okay, okay. High arched palate. This is if I put all together. This is
No, no,
cardiac.
no, no. You did not tell
Okay.
the cardiac examination. No, your main target is cardiac examination. Don't say
Yes.
negative thing. Just say positive thing.
Okay. I examined lovely Paul boy. He has systemic murmur with a thrill in the apex, radiated to the axilla, radiated to the axilla with a thrill, with dysmorphic features, also no scars, no cyanosis.
About no. There is no need, no. Just say
Mm,
positive. So I will say like this. First of all, he has no signs of heart failure and no signs of infective enterocolitis. This is too important, no, okay?
mhm, mhm,
Then he has some dysmorphic features with high arch palate and he is whatever you found, okay?
mhm,
Then
mhm,
on the chest examination, uh, there is apex beat shifted left and down, out, okay?
mhm, mhm, mhm,
And then there is thrill on the apex,
mhm,
radiating to that thrill is radiating to the axilla, and there is pulp, there is murmur, okay,
mhm,
audible on the apex, and it is systolic in nature, going to the axilla, and murmur is not radiating anywhere. So my
mhm,
diagnosis is a case of dash with dash.
mhm, mhm,
30 seconds, you can finish. If you say no cyanosis, no clubbing, no jaundice,
mhm, mhm,
then it
mhm,
is it is very difficult to finish in 30 seconds, no?
mhm, mhm, mhm.
Okay. Okay. So what is your diagnosis?
My diagnosis in this case mitral regurgitation.
Hmm.
Sorry,
Okay.
mitral regurgitation inconsistent with this dysmorphic feature could be Marfan
Very good.
syndrome.
Very good. Yes. Good. Excellent. How will you reach to the Marfan, and how did you reach to the Marfan, and how did you reach to the how you say this is Marfan, and how you say this is mitral regurg?
For Marfan, from the outside features like tall, and the hand reaches to the mid of the thigh, high arched palate for the chest. The chest, I think also the arm span will be يعني will have high arm span. This is from features, morphoid features.
In this picture, what are you seeing?
I
Suggestive of
see like this hand reach to the mid thigh.
more than mid thigh, yes,
Yes,
hand,
yes.
yes,
This more
and
features of the face, long face,
face, long face,
yes, high
yes.
arched palate, high
And
arched palate.
also the fingers are long and slender. This is called arachnodactyly.
Yes, yes.
Yes, yes.
From the according to the murmur is in the apex, systolic murmur radiating to the axilla with the thrill. This is the characteristic of mitral regurg.
True, true. Yeah, because if it is mitral stenosis, the murmur will be diastolic, isn't it? And the
Yes,
murmur will not go to the axilla. So it is not
yes,
mitral
yes,
stenosis. Yeah.
yes,
And apex has only two murmur, mitral stenosis and mitral regurg. There is no other murmur located in that area, right?
yes,
It is
yes.
not innocent murmur, definitely. Innocent murmur does not have
No,
any thrill, yeah.
yes, yes.
Innocent murmur does not radiate to axilla.
Mhm.
So this is okay. And how will you investigate? What will be the finding if you investigate this child?
Finding according to the syndrome itself, like from the skeletal tall stature, scoliosis, all
No, no,
of.
investigate. How will you investigate?
For the cardiac, I can make a chest X-ray, ECG, echocardiogram. For chest X-ray, there is could be cardiomegaly,
Mm,
in addition to left-sided hypertrophy.
mm.
In ECG, left ventricular hypertrophy. In echo also, I can see the chamber, or the chamber and the valve. If it's there is this morphic leaflet valve or not.
ECG, echo. ECG, you will find
Yes,
left axis deviation.
chest
Echo,
X-ray, ECG, and echogram.
yeah. Chest X-ray, left ventricular dilatation.
Yes,
And in
left axis.
echo, yeah, in echo, the valvular regurgitation. You can see the regurgitation. You can
Uh,
measure the gradient.
yes, through the valve.
And you have to mention also for investigation of Marfan.
Yes, investigation also of Marfan.
What?
Uh, Genetic, you mean
I don't know.
to
I don't know. I am
no,
examiner.
no, to improve that this is Marfan.
Yeah.
Genetic testing, gene FBN1 gene, fibrin,
Okay.
fibrin, and this is a kind of autosomal dominant.
Mm.
In addition to, I make skeletal chest X-ray for scoliosis. Marfan. I think Marfan, Rabbi.
Okay, so yes, we can do skeletal some X-ray of the back, and Marfan is a clinical diagnosis. Okay,
Yes,
genetic testing can prove fibrillin gene. Fibrillin gene is a autosomal dominant gene.
yes, yes.
Yeah, and we can do RSCGH genetic study, and is test X-ray, ECG, echo. We will do ophthalmological evaluation. We have to do because Marfan has eye problem. No, down and up and out, up and out.
Yes,
And
homocysteine down, صح.
yeah,
Nice.
down and in, yeah. So you need to revert it. Okay. So this child is now having mitral regurg. How will you manage mitral regurgitation?
This is surgical management
Mm-hmm.
uh, to valvoplasty, يعني replacement of the valve. Uh,
Okay,
Uh,
so if you replace any valve, what advice you, what
I
is the
have to put
next?
him for
Yeah,
long life anti uh, uh, long life
warfarin.
antibiotic.
No,
What?
no, 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 no. If you replace the valve, you have to give
Thinner,
aspirin and warfarin.
thinner medication. Yes.
Yeah, you cannot give antibiotic. Okay, you cannot give antibiotic. Antibiotic is for infective endocarditis.
Yes.
Sorry,
Yes.
antibiotic is for rheumatic fever. Sorry, rheumatic
In fact,
arthritis.
I mean, if I put removal from the valve and to like prophylactic of infective endocarditis, can I give him these antibiotics lifelong or no? Hello, hello. Hello,
Yes, sorry, sorry. I got a call, phone call.
no problem.
So yes, so blood thinner you will give, and antibiotic we do not give in this case.
Okay.
Okay.
Oh, okay.
What
Okay.
advice will you give to the parents?
Advice يعني to avoid the strenuous exercises, good oral hygiene, also uh, I think only this what I remember.
Why, Dr. Shainas? There are 8 to 10 advice. Why you did not revise cardiac advice? There are many,
Uh,
many, many cardiac advice like good
okay.
hydration.
Yes, good hydration and educate the parent about the signs and symptoms of acute heart failure, of infective endocarditis, according to education about to give the child anticoagulant and the importance of this. I think also don't. He is 7 years, like. Uh, piercing or something like this?
No,
No.
no, you are stuck in piercing. There are lots of advice without piercing, like sign symptom of infective endocarditis, yes. And then you have to give advice
Anti-failure.
about no prevent dehydration, prevent infection, good hydration, good nutrition, avoid hypoxia, avoid high altitude, good vaccination, proper vaccination.
Yes, proper
And
vaccination.
and the exercise should not be so much that the child feel breathlessness, okay?
Mhm.
And as we are giving blood thinner, I will counsel the parents about the blood thinner medication that they need every month. They need PTA, PTT, this monitoring,
INR.
INR monitoring, yeah.
Mm, mm,
And there can be sudden and spontaneous bleeding can be started, so we have to monitor, no?
mhm, mhm.
Yeah. So and the causes of mitral regurgitation, I'm not asking. The causes of mitral regurgitation is rheumatic fever, isolated, তারপর হচ্ছে টার্নার
Both both
post
surgical.
surgical, তারপরে
Yes,
হচ্ছে মারফান সিনড্রোম, এহেলার ডানলস
yes,
syndrome. Okay.
yes, yes.
Okay, very good, Dr. Shainas. Not bad, but revise again cardiac advice and listen carefully what examiner is asking the question. Okay, sometimes
Yes.
we do not understand the question and we answer something different, but actually examiner asks something different, right?
Mm.
And the name Paul and Bob are two different name, yeah. So you have to control what is the name,
So-
because suppose your name is Shahinaz, if I call you now Sattar, will you like it? You will not
No,
like
no, no, no.
it. Yeah.
Uh,
So yeah,
yeah,
so name is very sensitive in UK. Okay, you cannot change any person's name. Okay.
sure, sure.
All done, all done. You are very good, Dr. Shahinaz. You are
Thank you.
slowly improving. Mashallah, mashallah. Very good, very good.
Alhamdulillah, I tried very much my best
No, I know, I know. You are every day messaging
to
me.
stick to stick with your advices to me.
Nah, I know, I know. And you are following my class now. I can see you are following my cardiac class. And before you give any mock, just follow my class. Then it will be
Okay.
easy for you. And I can see, mashallah, you have tremendously improved. I'm very happy and I'm very hopeful. Inshallah, I will pass in
Alhamdulillah.
one chance.
Alhamdulillah.
Yeah?
Thank you very much, Dr.
Thank
Tamanna.
you.
Thank you. Thank you.
Thank you. Dr. Gabriel? Yes.
Yes, doctor.
Yeah, hi, doctor. This is your second mock or third mock?
This is my fourth mock.
Fourth. Oh, mashallah, you're doing good. Yes, you're progressing. So it is your communication, no?
Yeah, communication.
Okay. Dr. Giamai, please raise your hand. Your hand dropped. Maybe your hand get tired. It dropped. Yeah, keep your hand raised until you finish your mock, okay? Okay, so Dr. Gia is here or no? Left. I don't see her. Maybe she left. Oh no, you are here. Okay, okay. Okay. So the communication, do this communication of a child. Mm, What communication? Do you want any communication? Like you feel difficult or struggling, breaking bad news or difficult colleague, difficult mother? What do you want?
Up to you, doctor.
Oh, you don't want anything. Okay.
I'm okay with any questions.
Okay, you are okay, whatever I gave you, yeah? Okay. Let me just have a look. Um, um, mm, so, a 13-year-old child, okay, his name is Jack. No, his
Okay.
name is, I'm changing the name. Tell me one Malaysian 13-year-old boy.
Maybe Ali.
Ali, okay, okay, Ali, 13-year-old Ali, okay. So, Ali had severe autoimmune hepatitis and it went into hepatic failure. Multiple treatment were tried, like immunosuppressive agent, methylprednisolone, multiple treatment. He was on long-term steroid. Multiple treatment has been tried but failed. No auto
Okay.
and no at auto antibody medication did not help him. So he's 13-year-old having autoimmune hepatitis with hepatic failure, cirrhosis and hepatic failure. So now there is a liver transplant.
Okay.
Okay, but parent does not want their child to be sad, so they want the operation, but parents say don't tell this to our son that he's undergoing for operation. So this is the mother's and father's wish, that not to tell their son about the liver change, liver transplant. But a fifth year medical student was present shadowing you. You are the pediatric register. A fifth year medical student was shadowing you. He did not understand your counseling. Okay. He thought it is okay not to tell the patient because patient will be sad. He's only 13-year-old boy. He will be depressed. But he does not understand the concept of telling the patient. So it's an ethical dilemma situation. Please
Okay.
talk to the medical student. Medical student's um, name is Kathy. Kathy is a fifth year medical student. Kathy.
Patty. Okay.
Kathy. Cathy. Kathy.
Okay. Patty.
And talk to Kathy about Ali's liver transplant and what is the concept of taking consent and pillars of medical ethics.
Okay.
It's a medical ethics condition. Okay, I'm giving you 1 more minute because when you read this big scenario, 2 minutes will already gone. Okay, there'll be lots of background data, what's happening. Okay.
Okay.
Yes, start, please.
Okay. Hi, good morning. Yeah, Katie, good to see you today.
Oh, thank you, doctor. Yes, good to see you too.
Hi, Katie. Yeah, I understand that you want to meet me today to talk about something. May I know what is it?
Doctor, yesterday you remember in the gastroenterology clinic, you saw one patient, Ali, 13-year-old boy, and
Yes.
he is having undergone, he's planning to for liver transplant, and we referred him for tertiary center. And the parent told you not to mention this to the child about the liver transplant going on. But I don't know, doctor, what is the right answer? I mean, I did not understand because I'm only fifth year medical student, you know. So I don't understand, doctor. Shall we hide this from the child or not?
Okay, so Katie, I'm very happy that you are a very keen student. Before we start the discussion, is there any of your colleagues that want to join our meeting together?
No, doctor. Actually, in the rotation, I am alone in pediatrics.
Okay, sure, no problem. So don't worry, let me just explain to you like what is the case for Ali case, how we make the decision. So how far you know about Ali's condition? Like you know that like he is going for this liver transplant because of his autoimmune hepatitis. Yeah, and any other thing that you know about Ali's case?
Doctor, I know that from the history I read from your note that Ali had lots of medical problems, autoimmune hepatitis,
Yeah.
and then I read that this drug was resistant for him. He was not improving, and then what? At one point, his liver failed. So doctors decided for liver transplant. But I don't understand the concept of taking consent from the child because he is minor. He's below 18-year-old.
Yes, you are very right, Ali. I can see that you really go through like all the folders of Ali. So have you ever heard of this we call it ethical concepts, the four pillars of concept?
No,
When
doctor, I don't know. I don't know.
Okay, sure. Don't worry, Ali. I will explain to you what is it. So actually, there are four concepts. So the first one we call it autonomy. That means a patient has the right to make decision for his own. Yeah. So in Ali's case, he is 13 years old. He is so we take the age of 16. So usually when the child is below 16 years old, the parents will be the one helping to do the major decision for any procedure or any operation. Yeah.
Okay, but should we tell this to the child that what is the operation going on?
Yes. So regarding this question, so we can refer to there's another the another concepts which we call it beneficence. That means we will do in the best interest of the patient. So have you heard about this concept before?
No, doctor.
Okay, so for Ali's case, so we will decide like based on what is the best that we are going to do for him. So we can see that Ali's parents are very worried because they are worried that once Ali get to know about his medical condition, he might get very worried, he might feel depressed. So after weighing all the risk, the benefits, and also all the disadvantages, we think that not telling him regarding the condition will be at his best interest at this moment. Are you
Okay,
following me?
but if Ali asks us what is the operation he's going on, what will be our answer?
Okay, so if if Ali asks us, um, so probably we will get his parents to sit down together, and then we'll discuss with the parents when is the best time that we will let Ali know. So probably the parents can prepare him first before we talk to him so that he is
But
not.
as far as I understood, parents are in denial. Parents said they do not want anybody to tell about the surgery.
So, oh, you mean the parents?
Parents
Sorry.
said that they do not want to tell the child.
Okay. So let's look back at this the concept of ethics. So in the end, we still have to let Ali know about his own condition. Since he's 13 years old, but we need to find when is the best time. So probably we'll sit down together with the parents again, and then we'll decide like we can have a meeting together when reviewing like what the regarding the liver transplant operation. We can find the best time. That means we can join in together with the parents when we let Ali know what is going on.
Cannot we tell Ali some lie like you have a appendicitis or you have a gallbladder operation? Can we tell some lie? He will not understand.
Okay, so actually, telling lie is not ethical in a medical field. Um, there is another ethical concept which we call do no harm to the patients. That means we don't want to put any harm to all our patients. So we don't want our patients to get inaccurate information, wrong information. We want to make sure that they are well informed of what is going to happen to them. So telling lie is not something that is acceptable and not something that we are going to do in this case.
6 minutes, okay? You have 3 minutes left. So you said, Doctor, four pillar. I did not understand the first pillar. I understand beneficiency. You said do not do harm. I understand. And what are other pillars, Doctor?
Okay, so that's a very good question, Ali. You are a very keen student. So there are four pillars. The first one, as I mentioned, is beneficence. Second one, do no harm. And the third one is autonomy. Autonomy, that means a patient always has the rights to make decision for their own. So let's say if after they are being informed regarding the benefits and the risks of all the procedures, then they can do an informed decision.
Can Ali take his informed decision?
So we would have to decide whether he is a GILIC competent or not.
Who will decide this GILIC competency?
Okay. So we will talk to Ali to see if he understand what the procedure he's going on, if he can tell us, and also if he can understand what is the risk and also what is the side effects and the complications of the procedure.
But parents do not want us to tell him. Then how will you make his autonomy? Parents do
Oh,
not want us to tell him. So how it is autonomy is done? I mean, we can't tick the box of autonomy.
okay, understand. So if the parents still stop us from telling, we need to sit down with the parents and come to an agreement first before we tell Ali regarding this.
Okay, doctor. Okay, doctor, I understood. Thank you, doctor.
Okay, thank you so much, Ali. Ali, would you mind to just like summarize what I have told you just now?
Yeah, so today we discussed about Ali, who is a 13-year-old boy and he is undergoing liver transplant. And you said me about four pillars of medical ethics where it says that it is best interest to tell him, but we will have to slowly break down and we have to sit down with the parents and we have to check that Ali is Gillick competence or not. Yeah, doctor.
Okay, that's very good, Ali. That's very right of what you have said. And Ali, would you mind to just like probably you can just prepare and have a presentation regarding these four concepts of ethics?
Yeah,
Uh,
sure, doctor. Sure, doctor.
okay. Thank you so much, Ali. You are very good. I can wish you well in everything you are doing. And I will, if you
Time
have,
is up. Time is up.
thank you.
Thank you. So you are repeatedly telling Kathy as Ali, but Ali is the patient name.
So sorry.
She is Kathy.
Yeah. Yeah, Kathy.
Yeah, number one. This is number one mistake. Number two mistake, you came to the agenda very late. This is an ethical dilemma agenda. You asked the medical student how far you know about Ali's condition. It is not the scenario about autoimmune hepatitis or liver transplant. That
Okay.
is already decided. The medical student already know what is going on.
Mm,
She doesn't understand the ethical concept. So you should not start from the liver transplant. You should
okay.
start from the ethical concept, that how far you know about the consent and ethical dilemma. Do you know what is medical ethics and pillars? No, doctor, I don't know. Okay, let me tell you. So you have to come to the agenda within 30 to 40 seconds. You came to the agenda after 1.5 minutes, so you lost your time. In this scenario, there is no need of any description of Ali's condition, because Ali's condition we all know. It is a known patient in your hospital, and she did not come here to discuss with you about Ali's condition. She came here to discuss with you about consent, ethical dilemma. Why? What we will do now? Parents say, don't tell Ali. What we will do now? Will you tell or will you not tell? This is her question. Her question is nothing about liver transplant. Her question is, we will tell Ali or not? You
Okay.
have to be very clear about the agenda. Otherwise, if your agenda is missed, if you are roaming around, it is called stalling. You know what is stalling? You drive. Do you drive? When you drive, sometimes the driver lost the way and they do stalling. Stalling means ki when you lost your way, you stall around. Okay, you just move here and there with your car. You don't know which road to go. Similar
Mm,
thing happened with you. You are stalling here and there. You don't know what is the agenda. The main agenda is ethical dilemma. The main agenda is consent. The main agenda is four pillars of the ethics. Okay, so you have to directly come here. You have to start
okay.
from here. You should not start from liver transplant and everything. That is not the agenda of this scenario. Number one. Number two, repeatedly you are changing the name. That's very wrong. That's very, examiner will cut your mark here. Number three, you did not draw. You did not draw. There should be drawing of four pillars. Four pillars. Number four, you said wrong pillars. You said start with beneficiency, but actually you start with autonomy. And this is a serial. You have to maintain the serial. Autonomy is the first one. Number two is beneficiency. Number three is maleficent. Do not do maleficency. Number four is justice. You could not mention these four names in a serial category. You did not mention justice at all. You actually mentioned three pillars. Here, examiner will cut your mark. And your pillars were also ulta palta. Ulta palta means haphazard. You did not draw, you did not mention pillar in a serial manner. First pillar is autonomy, and this scenario is about autonomy.
Mm,
Autonomy is right to know what is my treatment. And a child who is GILIC competent, he has right to know. Even even a GILIC non-competent child, even a GILIC non-competent child, let me mute everyone, otherwise they will create noise. So Dr. Gabriel, open your mic, please.
yeah, yes, doctor.
Yes, okay. So even in a 5-year-old, 6-year-old, at least we have to tell him on his own way, in a playful manner, in a cartoon manner.
Yeah.
Okay, and it is a 13-year-old boy. He is definitely GILIC competent.
Mm,
GILIC competency means doesn't mean it is related with age. Clinic competency means it's a mental maturity. So who can test? You did not answer this question. Who can test? The There are psychologists. Okay, psychologists will talk because any chronic illness patient, psychologists are involved. So CAMS psychologist we can involve for So there are medical psychologists. Okay, medical psychologists, they will take the child's age. I mean, they will talk and they will tell you that, doctor, this child doesn't seem gillic competent. Even a 13-year-old can be gillic incompetent. Suppose a child with Down syndrome, a child with cerebral palsy, even at the age of 13 years, they are not gillic competent. So there is no point in talking to them. In those scenario, parental wish will be the last wish for the child. They have no judgment of good and bad. You understand? So age does not matter in a gillic competency. Matter is maturity. So who will decide? Psychologist. So your every answer should be so specific that examiner understand that you understand the concept, you understand the topic. You did not answer this line, that psychologist will decide. And it does not depend on age, it depends on mental maturity. An 11-year-old and 10-year-old can be mentally mature. A 13-year-old can be mentally immature. Understand?
Yeah.
So, this is another question. You started wrong, Dr. Gabriel. You started wrong. You started with beneficiency. You are always discussing the beneficiency. But this scenario is actually autonomy scenario. I have the right to know what is the treatment going on, and child has the right. So this is a wrong concept. You said we will not tell the child for now. No, it is a wrong concept. The child is transferred already for liver transplant, and his liver transplant is soon, within few days. Donor is already ready, everything. You have to understand the importance of the scenario. If we don't tell him now, when we will tell him? We will tell him in the bedside, in the operation table? No. So we have to discuss this issue with the parent as soon as possible, that we are really sorry that if parent does not want, we have to disclose this to the Ali, because this is his autonomy, this is his right to know. But before we discuss, we will send a psychologist to talk to him, to talk to his mental capacity, to understand, and according to his mental capacity, we will slowly give the news. But we encourage parents to give the news first to him, because this is their right. Okay, but if parent do not give this news, unfortunately, before transplant, we must tell the early age appropriate manner, মানে হচ্ছে whatever his situation, age appropriate. We will not give him the breaking bad news just like we give adult. Definitely we will give him in a child manner, because he's a child. Okay, so age appropriate manner. Psychologist may talk, or a pediatrician, or a consultant, whoever he likes. If he likes a nursing staff, if he likes a psychologist, if he likes whoever he likes, we will break the bad news to him. This is his autonomy. What is the beneficiency? Beneficiency is his anxiety will be removed. He is anxious now. What is the operation going on? Okay, this is the benefit. And do not harm. So treating a patient without the his knowledge is actually harming him. He may feel like neglected. He may feel defeated. He may have something to say, like, I don't want this liver or something. He may have something to say. But yes, below 18 year, a person cannot withdraw life saving treatment. For him, it is a life saving treatment. He cannot deny. But parental wish will be the last wish here. He cannot deny. If parent deny, then we will go to court. Okay, but for Ali, the matter is not about declining. The matter is about autonomy. Here, beneficiency, maleficiency, justice are less important. What is justice? Justice means, suppose we have only one liver. Which patient we will give the liver? One is Ali, another is, suppose, 5-year-old with metabolic disease or some rare disease that plus minus the child will not improve after liver transplant. Whom to give this liver? That is justice. Justice does not have any right or wrong answer. Justice means, if I give this liver, which child will have more chance to survive? We will give that liver to that child. That is called justice. So you have to understand these four pillars, and you cannot change the serial of the four pillars. Okay?
Okay.
And you have to describe the four pillar a little. Like, not too much, little. Autonomy means the patient has the right to know what is his condition and what is his treatment. Okay. Number two, beneficiency means we will always do good. So the whatever decision we will take and parent will take, that should be the best interest of the child. Do not do harm. That is called non-maleficency. Non-maleficency means under any circumstances, we will not do anything that is harmful for the patient. Like lying, telling lying. Telling lying is very harmful. The patient will lose his faith on doctors. So telling lie is not good. Okay, so this is maleficency. So do not do any harm. That means non-maleficency. And number four is justice. Justice, I already described. What is justice? There is no right and wrong answer. If this child is 13-year-old with Down syndrome and cerebral palsy, we may not tell him what's going on. We may tell him that there is a small operation, we will keep you sedated, we will keep you sleepy, like if the child is not understand what's going on. But if it is a Gillick competent child, he fully understand the concept and you can draw, then you should tell him. This is called beneficiency. He should know, and it will reduce his anxiety. He can tell people when he will be adult, he can tell people what operation he has been done, because after liver transplant, he will be needing a long term immunosuppressive therapy. Vaccine can be prevented. Has high chance of infection. So all these things he has to deal with. All the time parents cannot deal with this, so he has to know his condition, that why it's so precautious, why it is so important to maintain the infection balance, immunization, wearing mask, hand wash, why is so important for him, because he's infection prone, he's getting immunosuppressive drug. These things we cannot do without telling the child. Okay. So in a nutshell, this was a very easy scenario, but for you it became very difficult because you did not know what to tell. And for you, I felt like the concept was not very clear. At first, you said, we will not tell him. Then you changed your answer. Then you said, we will tell him slowly. So there are two kind of answers. So you were not sure about the concept. I understood. So now, what's your thought about my correction? I mean, do you feel the corrections are appropriate or no?
Yeah, yes, doctor. I think I get confused in the beginning.
Yeah.
Yeah,
Like later on, you corrected yourself that yes, we will slowly tell him. Yeah.
yeah, yeah. Thank you, doctor.
So that examiner will mark your confusion, that you are confused about the scenario, right?
Yeah.
So this same type of scenario came in another exam, that is HIV. In that time also we have to tell the child, teenager, that she is containing HIV because she will do sex with another boy and she will transmit HIV. But she will be bullied in the school, so we will not tell the school teacher to disclose this information to anyone. Okay. And then she needs extra vaccine, extra precaution because she is HIV positive. So if we don't tell her, that is maleficency. If we don't tell her, mother requested, don't tell this to my child that she is HIV positive, but that is actually maleficency. Same scenario. So what is my advice, guys? When you listen any mock, write down my correction, write down the discussion going on, write down the mistake that candidate did, because you will get same scenario but in a different format. Suppose we all are human, we have two eyes, two ears, one nose, right, two hand, two leg, we all are human, but we are different. Dr. Gabriel and me looks different, no? That means the scenario is same, you understand, but it will look different. This scenario came for autoimmune hepatitis and liver transplant consent. Same scenario, but it will look different, is that HIV positive girl, mother wants do not tell. So same scenario, and that is a talking to the mother, but this is a talking to the medical student. So you use lots of jargon, lots of medical language. Lastly, you gave leaflet, you tell him to make a seminar, you tell him to summarize, right? You tell him to good wish, that I wish your bright future in pediatrics, right? So this is the medical student scenario. But if it is a mother scenario, you will tell, I will give you some leaflet, okay, can you tell me what you understood, okay, and then you summarize, and then you give leaflet, and then you good wish for the child, like I wish speedy recovery for Juliet, okay, like this. Okay, so same scenario but in a two different format. Okay,
Yeah.
thank you very much.
Good, doctor.
Thank you. Dr. Jia, yes, open your mic. Anyone has any question, you can type because I muted everyone. Yeah, Dr. Jia.
Yes.
Yes, hi.
Hi.
You okay? This is your how many mock?
Third mock.
Third mock, and your exam is in October.
Yes.
So you have time, right? But did you book other mocks in the group?
Yes, I did.
Yeah, finish your booking, okay? Otherwise, if you keep empty slot, people will think the slot is empty and I will give the another student the chance. So book in advance, okay?
Okay.
And avoid Friday. Okay. How to draw? Just draw 4 pillar like let me see. Just draw 4 pillar. Nothing you need nothing to worry. So there are four pillars, suppose. So this is the 4 pillar. So there are 4 pillar. This is one pillar. One is autonomy. Another pillar is just a draw 4 pillar. Another is beneficiency. Another pillar is non-maleficency. Another pillar is justice. And these 4 pillars are equally important. Equally important. So describe what is autonomy, what is beneficiency, what is maleficency, and what is justice in a very simple manner. Describe, okay? Not too complicated because it is a medical student. And for mother, you do not need to describe all these comments. But for mother, you will tell that it is the best interest of the child to tell him what is his condition. For mother, you do not need to draw the 4 pillar. For mother, you will just mention what is the best interest of the child. But because it is a medical student, so you made it as a teaching session, right? You have to remember that medical student means it is an educational scenario, and mother means it is an information giving scenario. So the scenario is different in case of mother, in case of medical student. Okay, so with a doctor, it is always teaching. Okay, with a doctor, with a nurse, with a medical student, with a midwife, this is always teaching because you all are in the same team. You all are in the same profession, medical profession. But mother and father and the child, they are laymen, they are different. For them, it is not an education, it is information giving. Next, Dr. GMI, which station you have? Sorry,
CNS Neuro.
neuro. Okay. Okay, I'm giving you your neuro. Okay, I'm sharing the screen. So it is a 13-year-old girl. Please do the lower limb neurology. It's a 13-year-old girl, okay? Can you see my screen, doctor?
Yes.
So this is her work. 13-year-old. Her name is Laura. Do the lower limb examination of Laura.
Okay. I will.
Start.
There's no sound here.
No
Yes.
sound. Yes, no sound in this video. Yeah, start.
Sure. I enter the room, I greet the examiner and pass my mark sheet to the examiner. Then I will greet the mother and also the child and ask for permission to examine the child. Hi Laura, good morning. How are you today? Do you have any pain? I would like to examine you today.
Yes, no pain.
Okay, so I would like to start from the general inspection. How's the dimension of the child in terms of the height, weight, and also head circumference?
It's all okay. Normal.
Okay, okay. Is there any visual or hearing aid?
No.
Okay, is there any scar on the head or any VP shunt?
No.
No. Okay, is there any abnormal eye alignment?
No.
Okay, is there any myopathic faces?
I don't know. You saw the face? Did you saw the face? What do you mean by myopathic? Mean sad look? No, she's not sad look.
Not sad look. Okay, all
Yeah.
right. Then sorry, the instruction was to examine the lower limb, is
Lower
it?
limb, yes. Lower limb. His name is Laura. Yeah.
Right. Okay, I'll expose the lower limb up to the mid knee and check if there's any scar.
No scar.
No scar, any skin changes?
No, actually there are some scar, but not in the tendon, okay? The scars are in the heel, in the great toe. There are some scars, both in the both lower limb,
Mm,
okay, but not in the tendon area.
okay. Is it a surgical scar or
No,
trauma?
no, it's a traumatic scar.
Okay, all right. Here, okay, and the big toe. Okay, all right, sure.
Yeah.
Is there any other skin changes?
No.
Any muscle wasting?
Yeah, it looks like the muscles are very thin in the lower part of the leg.
Yeah,
Let
I
me
think
give you another picture, okay?
Mhm.
Okay, let me give you another picture of the leg. And this is her leg looks like, although it is not a female leg, but just imagine this is her leg, okay? This is her legs and this is her arm. Okay, see in the group. Suppose this is her leg and this is her arm. Okay, what you see in the leg, in the arm?
Okay, I can see hammer toes, deformity,
Mm, mm,
and also muscle wasting.
mm,
Mm, and they are symmetrical.
mm. And
Mm,
there are some traumatic scars, isn't it?
yes,
Yeah. Okay.
colors as well. Mm,
Mm.
okay. Okay. Is there any fasciculation?
No,
No. Okay. How about the tongue? Any tongue fasciculation?
no, no.
No. I will then proceed with checking the tone. Okay.
Mm.
Well, sorry, already saw the gate. Okay. And it's quite obvious, so I won't proceed with the maneuvers. I would like to
Mhm.
Gower sign.
Yeah, no need actually, Gavarsan, because you already said no that the gate is very obvious. So if the gate is obvious, you don't need to Gavarsan. But
Okay.
when the gate is not obvious, then you should do the Gavarsan.
Okay. All right. Um, I will then check the tone.
Yeah. Yeah.
By
Do it, yeah.
okay.
Yeah.
I check the tone like this, rolling the
Okay.
leg, and
And
then lift up the limb and do
flexion extension movement of the knee joint. That is also tone.
yeah, and also check for the clonus.
Yeah.
Okay, I'll do
Clonus. Okay, wait. One by one, go slow. So you are checking tone. There are four procedure of checking tone. One is the rolling, another is the flexion and extension, another is the palpation of the muscles,
mm,
pressing the muscles. Three different types of tone. Okay. So tone is low, floppy.
mm.
Then what? What you want to do?
I will then floppy. Okay, I'll check the other side.
Same.
Same. Okay. Then I'll check the power. Start with the say Laura, can you straighten your knee and try to lift up your leg?
She can. She can lift up leg.
Okay. Then I'll try to apply resistance.
No resistance. She can't.
She can't. How about the other limb?
Same.
Same. Then I will then check the hip abduction and adduction.
She cannot tolerate resistance.
Cannot tolerate resistance. So then I'll check the knee flexion and extension.
Same.
Same.
Hmm.
Okay. How about the ankle
Same.
dorsiflexion?
Same.
Same. The great toe
But
extension.
you felt that she can have a little resistance. She can move her hip muscles more than her leg muscles. So in the legs are more floppy than her hips. Okay, so in the hip joint, she can resist the power,
Okay.
but in the leg and knee joint, she cannot resist.
Okay. All right. Okay, then I will then check the reflexes. I will lift the limb up like this.
Hmm.
Put the leg on my hand. Put
Hmm.
all the weight on my hand, and
Hmm.
out on the knee.
So bilateral knee jerk absent.
Absent. Okay,
Hmm.
then how about ankle jerk?
Bilaterally absent.
Then okay, how about the Babinski reflex?
Downgoing.
Downgoing. Okay, all right. So I'll then check for the what is that called? Coordination.
Okay, she can do, but
Mm,
she's not very good in doing coordination, but she's doing coordination.
It's all good. No abnormalities.
Very slow coordination. Slow.
Slow.
Yeah.
Then how then will that proceed with sensation?
Hmm.
Okay, I will use the orange stick
Cotton
and
bud.
the
Cotton.
cotton bud.
Cotton. Yeah.
Okay. Then I will check on the dermatome. Starting from the L1 over the inguinal region.
Hmm.
L2 at the lateral aspect of the thigh.
Hmm.
And then I will check whether is it reduced and whether is it symmetrical both sides.
Okay. You have to give instruction to the child first
Yeah.
that
Okay.
I'm touching this
Yeah.
part, and you will close your eye
Mm,
and you will let me know how you
mm.
can feel or not.
Okay.
Okay.
Sure.
Suppose she cannot feel. Okay. And there are some discrepancy in touch sensation. Okay. So she cannot tell appropriately what is the location of touch. Now
Okay.
what? Now what you want to do?
I will check for the proprioception.
Proprioception. Do.
Okay. I will hold the big toe at the lateral part of the joint.
Hmm.
Okay, and then I will tell Laura, I'm going to move your toe upwards and downwards. Can you please close your eyes and tell me whether it's upwards or downwards?
Yeah. So that is also hampered. Okay. She
Mm.
cannot tell the. Yeah. So examiner is telling you.
Mm.
Do you want to do anything else
Um.
in
I will.
order to complete your diagnosis? Do you want to do any more examination?
I
If
would like to.
yes, what is that?
I would like to check the spine.
Okay.
Mm-hmm. Spine is
And
clear. And
anything else? Your time is not there, so examiner is just asking you. Do you want to do anything else? There you have no time left. Okay, you want to do spine. Okay. There is some mild scoliosis in the spine. Okay. Now please present your case.
oh, okay, all right. So I've examined Laura, 13 years old, who appear well grown for her age. Okay, he seems to be able to follow my instruction and interactive. Mentality is normal, and his
Remember, before you start, you have 30 seconds for presentation.
Okay.
Start.
So yep. Then I would he is walking with high stepping gait, and on examination of the neurological examination lower limb, there is bilateral distal wastings and also pes cavus with hematosis and callus seen over the bilateral lower limb with some foot deformities and also deformities over the hands as well. And there's some traumatic scar over the heels and toes. And neurological examination shows that there is a lower motor neuron sign as evidenced by reduced power, hypotonia, and also areflexia over the bilateral lower limb with distal more prominent over the distal more prominent compared to proximal, and there is also loss of sensation of proprioception symmetrically bilateral lower limb as well.
What is your diagnosis?
Tying all my findings together, my differential diagnosis would be Charcot-Marie tooth.
Yeah.
Mm.
Why?
Because it's a distal myopathy with sensory
Impairment. Okay.
yes.
And high stepping gait.
Yes, high stepping gait.
And there are some traumatic scars that indicate the child has no pain sensation.
Mm.
Yeah.
Yeah.
And there are some contractures in the body, which is in the back, spine, scoliosis. There is a high arch foot. Okay.
Mm.
And so these are the points in favor. What is your differential diagnosis of Charcot-Marie tooth?
Differential of Charcot-Marie tooth will be chronic inflammatory polyneuropathy.
Right, GBS, chronic GBS. Yes. Next,
Next, as in differential.
DD, yeah.
Um, what's that called? Frederick ataxia can present similarly.
Yeah.
You will have upward plantar.
Yes, plantar will be upgoing. Yeah. Friedreich ataxia usually present with ataxic gait, but they can also present with high stepping gait. Yes. Any other DD possible, like
Like L5 radiculopathy.
radiculopathy? Yeah, like deep intramuscular injection.
Yeah.
Yeah, they can cause, but that will be unilateral.
Mm.
But if there is any trauma, tumor, surgery done in the spinal cord, that can also cause bilateral neuropathy.
Mm. Mm.
You know? Yeah. So this is bilateral neuropathy, Charcot-Marie tooth. It is which type of disease, Charcot-Marie tooth?
It's peripheral. Is
No,
a
which type, genetic wise or something? What is the type of the disease, inflammatory or what?
inflammatory
No,
demyelinating.
no, it is Charcot-Marie tooth is not inflammatory. Charcot-Marie tooth is genetic disease. There is genetic hamperment. How will you investigate Charcot-Marie tooth now?
By doing nerve conduction studies. Yeah,
Okay, tell me finding also. Don't stop, okay? Complete
findings,
investigation, yeah.
there will be neuropathic changes,
Like,
low slow conduction.
mhm.
I'm not too sure about this.
Yeah, so nerve conduction will be low.
Mm.
And EMG te muscle conduction will also be low. Okay.
Mm.
So, and there is another investigation called sural nerve biopsy. You will find onion bulb deformity in the sural nerve biopsy. That is an important scar you will find in the back of the thigh, back of the leg. Okay. And genetic study, you can do RSCGH. What is the treatment of Charcot-Marie tooth? How will you treat this child now, and what is the prognosis?
The usually is not reversible.
Yes, it is actually gradually worsening. Prognosis is guarded. Yeah.
Yep, prognosis is guarded. So the paramedical involvement is important by involving the occupational therapists in terms of supplying ankle foot orthosis and also mobility aids and also splint to prevent further contracture, and physiotherapies to teach strengthening and muscle strengthening exercise to prevent further wasting of the muscles, and also to address any importance of keeping a good nutrition, and also to address any psychosocial support by referring child to psychologists if
What are the MDT team? What are the MDT team?
MDT team will be a pediatrician to monitor the motor function and also sensation regularly, and also collaborate all the paramedical team involving physiotherapists, occupational therapists, and also possibly psychologists if the child has
You already told psychologist. What are other team member?
other team member would be how about
What is the
social
complication? What is the complication of this?
complication, or would be contracture and
Mm.
we can involve orthopedic team as well.
Right, orthotic. There is shoe needed, no? The main complication is pain. They have pain and they have, due to food drop and due to their imbalance, they have repeated trauma. So you have to give anti-inflammatory drug to suppress pain like ibuprofen, NSAID, and there are some neuropathic pain. So you can use antidepressant, tricyclic antidepressant. And there is involvement of multiple disciplinary team taking care of in. So these children should not be overweight because they have difficulty in balance, taking good care of your feet, like regular checkup, regular cleaning of the feet, injury and infection prevention, then vaccination, proper infection control. Okay. And they have so much pain, neuropathic pain and pain due to trauma. So you have to give painkiller and regular monitoring of the pain. Occupational therapy will teach the child how to dress, daily living skill, and they will give small muscle exercise. Okay, if there is special equipment needed, if there is any special instrument needed, like big pen or grip holding grip pen or something, they will give. And physiotherapy will increase the strength of the muscle because they have foot drop. Okay, so they will increase the strength of the thigh muscle and leg muscle to prevent foot drop. Aerobic exercise, swimming, cycling, they are improve. Horse riding, they improve the physiotherapy and exercise. Yoga, so they have gradual physiotherapy exercise program, and there is no permanent treatment, permanent cure, so the prognosis is usually guarded. These children usually deteriorate with time. Okay, and the orthopedic surgeon will do the spinal surgery or plus plantar fascia surgery because their plantar foot is so contracted that they cannot walk properly. So plantar fascia contracture release, partial release, and whatever osteotomy or whatever needed to prevent their infection and everything. So multidisciplinary team, many important team are involved. Genetic counseling is needed. Okay, school, special school, school equipment, school modification, home modification, special teacher. You have to mention this serially one by one. Okay, do not do clonas, Dr. GMA. If it is a lower motor, never do clonas. You started with clonas. That's when I stopped you. That wait. Don't do clonas at the beginning. You should not do clonas in a lower motor neuron child. Clonas is reserved for upper motor neuron.
So,
Okay. And your examination was okay, but I think you should understand what you have to complete the neurological examination by doing upper limb. Okay, by doing leg, gait, and back. So you said spine, but you forgot upper limb. Okay, in this child, cranial nerves are not very important, but in one sense, it is also important because cranial nerve will be involved in case of Miller-Fisher variety in chronic GBS. So you can offer cranial nerve and upper limb. Without cranial nerve, without head examination, upper limb examination, neurological examination is actually incomplete. Okay, so if your task is upper limb or your task is lower limb, please complete the neurological examination by doing another limb, opposite limb. So if your task is upper limb, complete by lower limb. If your task is lower limb, complete by upper limb. Because you have to know these features are only in the lower limb or generalized. In case of Charcot-Marie-Tooth, it started with the lower limb, but it goes to generalized. That's why this child hand, you see the hand is claw hand. Okay. So it becomes generalized. Yeah. And another thing is you have to understand the system that you have to do cranial nerve as well. Okay, do the cranial nerve examination, head examination, upper limb examination. That's how your neurological examination is complete. Otherwise it is incomplete because your DD is Miller Fisher, your DD is GBS, right? Okay. Any question from your side? You improved a lot, Dr. Giamai, and also Dr. Gabriel. Both of you improved, like speed wise, but I want to get more improvement from you, like speed wise, okay? And very methodical. Before you give mock, please listen that class. it will help you to understand the mock, how to give the mock. Yeah. Okay. Anyone has any question? You have any question, Dr. Chiamai?
No.
Okay.
Thank you.
All right then, guys, we finished. Thank you very much for joining. See you tomorrow, inshallah. Thank you.